and welcome back. I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. And a special welcome to those of you who are joining us live via our web stream. We are so pleased to have Joanne Scillia here in the studio. She is VP of Population Health at Renown Health. She's based in Reno. Welcome, Joanne.
Thank you very much. It's nice to be here.
Now, at Renown Health, you do some work with social determinants. Can you describe to me what that involves?
So, the social determinants of health are those things that patients, members, people in the community will have that will escalate perhaps a medical condition. So, in other words, if somebody has congestive heart failure and they also have some social determinants of health, their cost of care is generally more expensive because of that. So some of the key social determinants that we look for are financial issues, food insecurity, housing insecurity, those types of things. When individuals have struggles with those areas, they generally will struggle with higher level of acuity with their disease process as well.
Does Renown Health have strategies to address those kinds of forces that are involved in someone's life, those social determinants?
So we're working currently with within our electronic medical record to develop an overall evidence-based assessment to target those specific social determinants of health, and then use key data and analytics to utilize with our analysis to try to identify those specific subsets of people that we can manage in the community in order to reduce unnecessary admissions, ED visits, so on and so forth. We're also working with community resources and providers who are mostly not-for-profit organizations who will focus on one or maybe two of those social determinants of health and try to link these individuals with those resources. So there might be food banks or closets within the community that we can link people with, food delivery systems, to the point where we want to make sure that if they're getting food delivery or food baskets, that that food that they're receiving is appropriate for their diagnoses. So in other words, if they're diabetes, you get a food basket that's appropriate for diabetes, COPD, CHF, so on and so forth.
What kind of teams do you have to have in place to first assess the data and then to do something about it?
Receipt of the data is obviously first and foremost, so it's developing that evidence-based tool to ask the questions, knowing when to ask the questions, who's going to ask the questions. Very important, because the information that we get, we want to be accurate. And then again, how often do you ask that question? So if a unique patient comes into our healthcare system and they see a primary care physician and they also see a cardiologist and a pulmonologist and they have an admission, how often are you going to ask those questions to determine that you're getting the right information? So we've decided along the way that we're going to ask it every time they cross the threshold to see if there's been any changes with any social determinants of health. So that's number one. Number two is having a robust health and wellness program with community partners. So we want to make sure that if we ask the question and we find that there is an issue with any one person with any of these social determinants, that we actually have an answer and we have a referral system in place where we can help them to overcome those barriers.
Is there any data that you've seen already that this works, that people are moving in the right direction in their care based on some of these efforts that you've put on issues outside of your regular, I guess, approach?
So, I mean, we can't tackle them all at once, although we'd love to tackle them all at once. Within our pediatric division, we have a Child Health Institute at Renown, and they're really two main missions are hunger and homelessness among the child population within Reno and northern Nevada. So they're working very hard and finding out those children that utilize our system who are homeless, and that's usually the adolescent age, as well as those children and families who are food insecure. So we're piloting it with that population first, and then directing those families to these food resources in the community. We haven't found yet, it's just starting, we don't have the data yet to collect to see what that's going to do with admissions or readmissions, but we are, I would say that we're confident that we're going to see, probably over the course of the next year, we're going to be able to see a reduction in costs and reduction in ED visits, so on and so forth.
Okay. Are there any other messages that you're really leaving with attendees at this meeting?
I think the biggest thing is that care needs to be moved into the community as much as possible. As we, as a health system here in the United States, move from volume-based care to value-based care, we need to be able to find ways to keep people in the community as independent as possible and deal with these social determinants of health in order to reduce the high cost care that we have. And that's really the message that we're trying to say. How do we, as a healthcare system, provide that care in the community to decrease costs overall and yet keep people as healthy as possible?
And how are you finding your meetings here at this conference?
You know, I think everybody's talking about the same thing. They're all trying to figure out how. I mean, population health is now a pretty big buzzword within the healthcare system across the country, and everybody's, I think, struggling with the same types of things, especially those who come from large integrated healthcare systems with thousands of employees and hundreds of thousands of patients. How do you work together and break down the silos that exist to try to change the way we deliver care today and move it into the community? And everybody, I think, is really trying to tackle that same thing. And I've learned a lot from different organizations across the country. Everybody's kind of in a different place now. Some people started this years ago, some people are just starting it now. Mm-hmm. But this is really helpful and useful because we're learning from one another. And I'm not going to go down a path if somebody else has gone down that path and they learned that it hasn't worked. Right. And that's the value of something like this.
Great.
To be able to talk and to really connect with others and learn from others.
Great. Joanne, thank you so much for your time today.
Thank you.
And I'm Mabel Jong. Thank you for watching. Stay tuned.